Great. Thank you so much, Steve. Welcome everyone to the webinar today on financial capacity for people living with dementia and their caregivers. In this webinar series, the Administration for Community Living's National Alzheimer's and Dementia Resource Center has partnered with the American Society on Aging. We're pleased to have all of you in attendance today. I want to send a big thank you to our speakers, Cindy Hounsell and Laura Beaton of the Women's Institute for a Secure Retirement, for being here today. Cindy Hounsell is an attorney and retirement expert who has spent her career helping women secure their financial futures. She directs the National Resource Center for Women in Retirement Planning and is founder and president of the Women's Institute for a Secure Retirement, the only organization to focus exclusively on the unique financial challenges that women face and to support women's opportunities to secure adequate retirement income through research, workshops, and partnerships. Dr. Laurel Beaton has spent her career working on retirement income policy as a researcher, writer, speaker, and educator. In addition to policy research, Beaton's experience includes as a staff member of the American Indian Policy Committee for Senator James Abourezk, and she is also a member of the Alumni Advisory Board at Virginia Tech. I will turn the presentation over to Cindy Hounsell and Laura Beaton at this time. Go ahead.
Thanks, Sari. We appreciate the opportunity to be here. I'm going to just start by telling a little bit about WISER. WISER is a nonprofit founded in 1996, and the driving force behind that was the shocking statistics about poverty among older women, and so that's been our focus, to alert women and their families to plan for their future finances as best they can. To provide women with basic financial information, help educators and policymakers understand barriers for women to participate in the nation's retirement systems, and bring together stakeholders to work towards solutions that improve women's retirement income. WISER operates the National Resource Center on Women in Retirement Planning. It's a one-stop gateway to provide basic retirement information and resources, and we will be providing fact sheets to back up pretty much most of the slides that we're talking about today, and because we need further explanation on a number of these slides probably, and so you'll have it just as you watch. Just know that there'll be additional information provided. So WISER's partners include a diverse group of organizations working with older adults, low-income women, women of color, and women with limited English-speaking proficiency. And the organizations we work with are mainly groups that are part of the Aging Network, as well as various trade organizations and companies that work on senior issues. So what does the center do? Well, the center does webinars, for one thing, and we provide a clearinghouse and technical assistance center for retirement information tailored specifically for women and their families, and have presentations. We have toolkits that are available so that someone from your organization can become a presenter. We have teacher guides that help you walk through many of our programs. We do forums and events to engage advocates, leaders, and policymakers. And you can contact us at info@wiserwomen.org. The session will cover building financial capacity, the cost of care, healthcare programs for older adults, what they cover, Medicare, special needs plans, Medicaid, financial capacity options such as reverse mortgages, immediate annuities, the legal and financial documents that families and caregivers need, end-of-life planning, caregivers, who they are, the financial impact of caregiving, money mistakes that caregivers make, and financial steps to ensure the caregiver's well-being. And as I mentioned, all of these fact sheets and topics have resources available on our website and will be made available at the end of the session. So now I will turn it over to Laurel.
Good afternoon, everybody. Thank you, or good morning for those of you who are still on the West Coast and in the middle of the country. Those of us in the East Coast, it's afternoon. I want to start out with average cost of care because I think it's important to note that the cost of dementia care is almost twice what the cost of average care is. And by the way, the last slides in the presentation have references to all the wonderful researchers, writers, and the papers that were published that show where these data come from. Again, the average total cost for, and this is the last 5 years of life, and that includes Medicare, Medicaid, private insurance, informal care, and out-of-pocket care. Dementia is close to 300,000. Heart disease, 175,000. In out-of-pocket spending for patients with dementia, 61,500, and without dementia, 34,000. And what is worth noting here is an awful lot of these expenses are not covered by insurance. The cost of dementia care medications between $177 and $400 per month. Adult daycare, and I'm going to talk about adult care more later on, the national median monthly cost is about a little over $1,500 a month. Nursing home, now be cognizant of daily costs vary by state, but the national median monthly cost for a shared room in a skilled nursing facility in 2018 was $7,000, almost $7,500 a month. Think of that in relation to what a Social Security benefit might be or what it is as a son or a daughter you might be paying for a parent out of your paycheck. A senior living or assisted living residence, some of these are memory care. The costs, again, vary by state. The national median monthly cost in 2018 was $4,000. But again, if it's dementia care, the cost can increase. At-home care, this is one of the big pushes now, national home and community-based care. The national average for 2016 homemaker services, $20 an hour. A home health aide, $28.50 an hour. For homemaker services, the median, $4,000 a month. A home aide, a little more than $4,000 a month. And for unpaid care, that is family caregivers, when you stop by your mother's apartment and you bring her groceries, or you buy her a new outfit, or you pick up her prescription drugs. $7,000 in out-of-pocket costs are what family caregivers spend each year. A lot of people believe that Medicare, boy, I turned 65 and everything is going to be taken care of. So I think it's important to look at what Medicare does and does not cover. Medicare does not cover custodial long-term nursing home care, what a lot of us just call long-term care. Medicare does cover up to 100 days in a skilled nursing home. I've written home there. They're called SNFs, skilled nursing home, nursing facility. Same thing after a qualifying hospital stay. And a qualifying hospital stay is 3 days consecutive in a hospital. That does not include the day that you spent in the emergency room waiting to get admitted to the hospital, and it does not include the day that you left the hospital. So keep that in mind. An individual's Medicare, while the individual is living in a SNF, that is covered. In other words, does a physician or a nurse come in and look at you? That is covered. And home health services for up to 60 days at a time. If you are homebound, you require physical or occupational or speech therapy or intermittent nursing care. And note this, a Medicare-enrolled physician must certify the necessity of those services. That's important to keep track of. Special needs plans. Special needs plans started in 2006. They're a kind of Medicare Advantage plan, which is basically Medicare Part C. They are available for individuals with dementia. They provide all the care that a Medicare Advantage plan is required to provide, as well as the extra services tailored for people who have dementia, which means that if you have dementia or someone you're taking care of has dementia, that person can stay in their home longer. To qualify for an SNP, the individual must be 65 or older and a U.S. citizen. I've just been told I'm speaking Minnesota, which is I speak a mile a minute. Slow down. So I'm going to slow down. I have a lot to say, so I have to say it quickly. I'm going to slow down now. SNPs are available for individuals with dementia, and they provide all the care that Medicare Advantage plans provide, which is basically Medicare Part A and Medicare Part B. And they provide extra services that are tailored for people with dementia. To qualify, you have to be 65 or older, a U.S. citizen, or a legal resident for 5 years. You must have Medicare Parts A and B, that's your hospital and your medical insurance, and you must live in the planned service area. SNPs may not be available in all parts of the country, so this is something you will have to check individually to see if there are SNPs available where you live. And you have to meet the plan's eligibility requirement for a severe disabling chronic condition such as Alzheimer's or other dementias. And that means that your physician has to diagnose you as such. Now, some of the potential supplemental benefits, and that would depend on the individual plan, cover modifications for home safety, such as simple things like bathroom grab bars, non-medical home care, such as someone who will come in and help with bathing, or a homemaker who prepares meals. Adult daycare services, and I think this is important. Adult daycare services provide a safe environment with counseling, meals, activities, and behavior management. They are, and we talked about the cost earlier on, adult daycare activities are generally take place in adult daycare centers. They're designed to provide care and companionship for older adults who need assistance or supervision during the day. What this does is this provides the caregiver with a break, or the caregiver can go to work part-time in the morning or all day. It depends on how the adult daycare is set up. It allows the daycare provider something, a little bit of time where they can do what they need to do. The daycare center will provide social activities and maybe health care. They may possibly have a nurse coming in and checking you. They may provide meals, health care screening. They may provide transportation. That depends on the individual adult daycare center. One of the resources that we have linked to in the last slides is the Elder Care Locator, and the Elder Care Locator can help you find an adult daycare center near where you live. Now, the costs vary. It depends on what kind of services and how long you need the services. They can range from $25 to $100 per day. And they can be reimbursed depending on where you live and what the setups are in your state and what is covered by your Medicare insurance. And also there may be assistance for the financial issue of adult daycare from Medicaid, the Older Americans Act, and if you're a veteran, from the VA. So those are things to keep in mind as far as adult daycare. Also, there is assisted living, which we mentioned before in the cost section, that an assisted living community helps persons with advanced Alzheimer's or dementia. You have to find a place that does take individuals who have memory and dementia issues. Medicaid. Medicaid is the program for low-income individuals, low and no-income individuals. It's a joint federal and state program. And in most states, people who qualify for supplemental security income, SSI, are eligible for Medicaid. Not all, though, and you need to check your state rules. SSI benefits are approximately 75% of the poverty threshold. The threshold for people 65 and older in 2018 was just over $13,000. To give you a feel, 75% of that is just about $10,000 annual income. So it's a very low income threshold to qualify. Let me get my next slide up here. In some states, people with chronic illness or disability who require long-term services and supports but have income and assets above the Medicaid limits can qualify to receive those supports, and those are dual eligibles, and again, those you need to look at your state-by-state requirements. And long-term services and supports are designed for individuals who require a level of care equivalent to that received in a nursing facility, and that would be someone with advanced dementia or Alzheimer's. Now, these services can be provided in the home, in the community, or in a facility. And eligibility is determined by assessing health conditions and functional needs of the applicant. That says that someone is determining that the person you are caring for indeed has a dementia or a level of Alzheimer's that requires that level of care. Now, we've talked about the costs, what the individual costs are, and the government programs. We have several financial product options or opportunities to present to you. One is reverse mortgages, and I know we see them. I think we see the television stars and movie stars advertising these on the various channels on television. Here's what they are. Homeowners age 62 may borrow against the equity value in their homes. In other words, if the individual has paid in full for their home, they can borrow against that. And it gives the homeowner a loan based on age and equity as a line of credit and as a lump sum or monthly payments. And the homeowner does not need to repay a reverse mortgage if he or she lives in the home. And that is the most important thing to keep in mind as you're looking at a reverse mortgage. The loan is repaid when the owner sells the home or dies. So that means a reverse mortgage may be great for some people, but not necessarily for everyone. If an individual does not want to stay in his or her home long term, it may not make sense. And you see there we've put down that HUD loans require counseling. And that is if a reverse mortgage, if the loan comes from HUD, that means that the individual must be counseled, and both NCOA and AARP provide counseling about what it is that you are getting. Seniors considering a reverse mortgage should look for a reputable lender and be sure to understand the terms of the loan. Not all lenders and brokers are reputable, as is true of everything in life. Another option is immediate annuities. And the goal of an annuity is to provide a steady stream of income during retirement. And that's put a line under that. The annuity can be purchased from an insurance company for a lump sum and can guarantee a regular monthly payment for the rest of the purchaser's life. Now, annuities can vary. You can get a 5-year or a 10-year or a lifetime annuity. Just be sure you understand what it is you're buying. An annuity transfers the job of managing assets to the insurance company so that payments are received for the rest of the individual's life. Immediate new annuities may be right if retirement expenses are not covered by a monthly retirement check and a Social Security benefit. So that means that if an annuity has been purchased, that would be an extra regular payment coming in monthly. If there is an expectation of living a long life, if the individual is in good health, an immediate annuity can be a good choice. On the other hand, if the opposite is the case, the individual may want to manage the lump sum by themselves or have a financial manager manage that for them. Now I'm going to turn over for some of the legal agreements we discussed to the attorney here who is presenting, Cindy. Take it away, Cindy.
Laurel. So legal agreements for families and caregivers, and these have become popular in the last couple of years, and I think one of the things that is important to know about these agreements are that it allows families to get involved early and work with the elderly parents to understand the health situation, the finances, the availability and costs of long-term services and supports in their community. As Laurel mentioned, the Elder Care Locator and some other resources, but it's really important to know what is available in your community and what options are available. And that can be done just by, looking at the ACL and Administration on Aging website to see what's available and what resource centers are also available with different information. So knowing about the options can avoid a panic when an emergency medical situation hits, which of course is usually the way most people get involved in their parents' care. Something happens that's unexpected, and so then you have to deal with so many different issues. But the personal care agreements will, help you figure out how will we handle the daily tasks, the shopping, the meals, transportation to get to the doctor, the medical care, the home repairs, the cleaning, and tasks for financial tasks such as paying the bills. And it allows for a written plan that can be reviewed regularly, especially as the health of the older adult inevitably declines or other family circumstances change. It can also help avoid family conflicts about who will provide care and how much they'll be paid. And in the past, one of the reasons that we've become interested in these agreements is because often it falls on the person who is living closest to the parents or, in the same geographic area. And then one person is taking on the burden when it really needs to be spread around. Most people can't afford to take on all the things that have to be taken on. So the types of cares and services and payment are available for everyone to help decide on. And we have a wonderful booklet which was part of our National Resource Center called Financial Steps for Caregivers, and there's more about that at the end under our resources. So here are some of the things that the care agreements should include. And this can also be informal. It doesn't have to be, if there's a lawyer in the family, I'm sure it can become very detailed and may even be a burden. But it could just be an informal care agreement where people have just talked about all these things, and it sort of helps keep the situation moving as the health of the older people deteriorates, which is usually what happens. So how often the services will be provided and how much and when the caregiver will be compensated if there's an outside caregiver or, a family caregiver, how long the agreement will be in effect, where will the services be provided, like will there be a caregiver agency that will be hired, a lot of different decisions around that. Anyway, and the terms of the agreement can be modified. As I said, it can be much more informal. I think families get into it, and it just helps to have that piece of paper there. So you can also check out this website that we use for a number of different issues called caring.com. Then I'd like to just mention a few of the legal documents for the financial caregiver, things that you really need to make sure that you have. And one of the most important things is people are always asking about this, but I think whatever state your parents live in or the person you're caring for, you go on that state website and you find out what is needed to be included in an advanced care directive. It will be usually on the state website. Almost every state has this. It will have the particular forms that are needed and how they should be executed, whether they need to be notarized. But here are three of the most important documents that are needed. So as I said, the living will, which makes clear the health care and life support wishes, the durable power of attorney for health care, which is the health care proxy. And it's advisable to have both of those. People sometimes think like they only need one, but the health care proxy and the living will, because the person with the health care proxy or the power of attorney is designated to make the decisions based on your instructions if and when you're unable to speak for yourself, while the living will specifically outlines your decisions about health care treatment, but it doesn't provide a spokesperson. So together, the two documents can work to make your health care wishes clear and guarantee that those wishes are carried out. And then a durable power of attorney for finances gives authority to a trusted individual to make financial decisions on behalf of the cared for. This document allows the chosen person to handle any financial transactions, which means they can be selling your property or doing a lot of different things. So you also have to pay close attention to who that person might be and whether that person is really aware of how you live your life, and what your needs and your future wants might be. So not a casual document. So the living trust allows a trusted person named by the care to transfer ownership or title of assets into a trust and designates who shall receive the assets when they're due, but keeps control of those assets throughout their lifetime. The last will and testament, and I think there's a percentage of Americans that don't have one of these documents. About 75% is one number that I've seen. So everyone needs this, but especially if you're caring for someone whose health is deteriorating, because it provides the final directions, who'll receive the cared for individual's assets when he or she dies, and will identify an executor to carry out the will's directions. And again, looking at the state requirements and to learn, because every state has a different requirement about who can be the executor and whether or not they can be named in the will. So you want to make sure that you haven't ignored like some of the rules Financial documents and account numbers, this is something every one of us should have. I'm personally checking off in my own head, like which of these I could put my hand on in a minute. But usernames and passwords for all online accounts, we hear that story all the time. That's a nightmare. So that has to be somewhere, and people often have them so locked up, you know, you wouldn't find them until you probably went through the whole house and sold the house, and then you might come upon some of these things. So having them handy is important, knowing where they are, the bank accounts, the credit card, the monthly bills that have to be paid, like the mortgage and the utilities, loans and other debt, Social Security, Medicare, Medicaid information. People really need to understand that. And then if there's income coming in from a pension or, you know, a 401k type account plan, and as Laurel did such a nice job on annuities, if you are fortunate enough to have a monthly income, that's also coming in to help pay for the cared person's expenses. That's a really good thing and good to know about. And then insurance policies, life, health, long-term care, Medigap. We have this one horrific story about two sisters whose mother, they lived on the East Coast and their mother was in Arizona. And she actually kept telling them she wanted to tell them things, and they just sort of poo-pooed it, and then her health deteriorated. And so after they kept flying out to take care of her and churning her because she wasn't in the hospital maybe long enough to get taken care of and paying for things they didn't have to, they found her long-term care in policy where she had been trying to tell them this. So it's really important to get as much information as you can early on. And then tax returns, vehicle titles, property deeds, birth certificates. As I said, everyone pretty much needs to know where those documents are. So then another issue that's less known is that some adult children could be forced to pay for their parents' long-term care through state filial responsibility laws, which require adult children to support indigent parents. 30 states have such laws which obligate adult children to provide necessities such as food, clothing, housing, and medical attention to an indigent parent. So the laws vary from state to state and generally do not require children to provide such care if they do not have the ability to pay. The laws haven't been enforced as much as they could be, but that might change as states cope with the increasing burden of nursing home costs on Medicaid budgets, and we've already heard about a number of cases starting to pop up. So again, the most important thing for the family, even a family that's working on one of these family care agreements, is to know what the state rules are, so that there are no surprises later on. Then another recommendation is that, and there's a possibility that there's also a financial planner that's been hired at some point or has been helping for a long time. And if that's the case and it's somebody that your cared for person trusts, that's even more helpful. But if that isn't the case and you need information about the state, then interviewing planners, looking for a planner who can talk about risks, and ask how they are paid for their services, whether they have a salary or a flat fee, and whether they get a commission for anything that they're selling to you. It used to be that the fee-only planners were easy to find, but that's less so, I think, these days. Although if you're fortunate and you ask around, I think you can find someone that you can go to just like a lawyer and ask them to make sure that they can give you a plan in writing. And then you can check their references as well. And then we have resources again on this. And then, this is just a summary of what we just talked about, but these are, making sure that these legal and financial documents are in place is important, the advanced directives that I mentioned. And then, having the information either in a letter. I remember my own dad had like a 5-page letter and knew exactly what he wanted. And so that made it so much easier when, my mother couldn't decide what he did want. And so it was just all written up, which is a really good thing for anyone to do. So, knowing like what kind of medical treatment do I want, taking care to know whether there should be do not resuscitate order. I just have friends who just went through this with a brother who was very efficient and had done financial work his whole life, and yet this was sort of where it all fell down, didn't have any of the necessary documents. And, the funeral services, et cetera. So knowing all of this, and with these friends, it's sort of between two states and not knowing where the person wants to be. So then we'll talk a little bit about the caregivers, and I think, there have been a lot of news articles about this, but there are a lot of people doing this because we have, 10,000 people a day turning age 65, so there are a lot of, older adults who are going to be in this situation where they need help at some point, and there are a number of people that are already doing this work for a long time. You can see the numbers that, get up to 8 hours each week providing care, and so that's significant, but, more than 20% spend more than 40 hours each week providing care. Then there's the financial impact of being a caregiver, where a number of caregivers report making adjustments to their work, cutting hours, taking leaves, receiving warnings at work, or not taking promotions and things that, make a big difference. And so Laurel already mentioned the estimate of the approximately $7,000 a year annually in out-of-pocket costs for caregiving, and there have been a number of bills in the Congress over the last 2 sessions about caregiver credits, although none of them have passed yet, but there are a number of bills that would really be helpful if you have the tax credit and you're able to use it. So the other number that's quite been around, I would say, for a long time, is probably even more than this, but at this point is the 300,000 in wages, Social Security benefits, and private pensions that caregivers lose over their lifetime. And then money mistakes that caregivers make, and one of the reasons we like to talk about those family agreements is just to make sure that one person isn't taking on too much of the burden, which is really what happens, and not thinking about their own finances when they start to do the caregiving, and paying for the everyday expenses that they probably can't afford, or if they afford to do that, then they can't end up saving for their own retirement. And not realizing that at some point they're going to end up living on their own someday, and they're going to need to pay for their own care. So it's good to be considering all of that as you go through the process of caring for someone. And the other mistake that caregivers make, especially women, is that they help everyone else first, children, grandchildren, co-sign loans that they probably shouldn't be co-signing when they can't afford it. So it's paying attention to your own caregiver well-being. So thinking carefully about the consequences of leaving a full-time job, losing your health insurance and future benefits, and asking for help, which I think we've pounded home at this point, making a plan for managing your own money, and plan for your retirement needs, which are income, health care, housing, etc. So thank you very much, and it looks like I think we have a little bit of time to go through the next few slides, which have the resources. And Laurel, if you want to jump in, feel free to do that. But we have some of the resources that we promised as we went along. So are here, checklists, etc.
I think it's important if you look at the references, they would be slides. Let me see. Let me click down to the reference slides. Here we go. These slides here are showing where the research for the data on cost, where it was done, and will give you precise numbers and years of publication and also years of the research, so you can determine whether or not this is talking about right now or maybe a couple of years ago. I am assuming that no matter when, the cost of this kind of care is going to increase. So we have some papers that were published in 2018, one in 2016, one in 2015. So you can assume as you go through, these are slides 7, 8, and 9, and the costs state by state and issue by issue. So I think that's important, and you can read the full papers there. Also give little advertisements for the National Alliance for Caregiving and AARP's Public Policy Institute for some of the research they have done on caregiving, and the MetLife Mature Market, their study on caregiving costs. All of these are listed there on those two references slides. For those of you who are researchers and want to get into more in-depth look at this, that's the place to go. The resources for elder help and information are there on the slides ahead of that for managing someone else's money and places to go for example, lawyers who specialize in elder care, or I need to find an adult daycare center. Oh, I'm sorry. Cindy just said, Cindy, will you jump in and tell me what you said?
Okay, well, what I said was resources for managing someone else's money are pretty important because you may just think it's being done casually, and then if you have to end up doing Medicaid or other programs, and someone's going to want to trace every penny that's been spent for the last number of years. So these resources are just invaluable from the Consumer Financial Protection Bureau, the Office of Older Americans, and they help the financial caregivers carry out their duties and responsibilities. And there are a number of guides for people in 4 different fiduciary roles: the agents under power of attorney, court-appointed guardians, trustees, and government fiduciaries. And also, if you need more help, there's the National Elder Care Attorney who can help find legal assistance, and then the National Center on Legal Rights is also an ACL National Resource Center. So those two aren't here, but we will add them after this slide. So thank you.
So I think
we're ready. Thank you so much.
Yeah, ready for questions.
Great.
Yep.
I'm going to go back up to your contact information, or the contact information where people can find your website and find all those resources. And then I'll start with some questions. We had a few questions come in during your portion of the presentation, Laurel, about the special needs plans. A few folks were asking if there's a listing anywhere of states that offer those plans, and others were asking. Go ahead.
I was going to say, I'm sure there is, and I suggest that you go to either your state's website, your state government website. Also, you can go to, if you just Google special needs plan and your state, and that should bring it up.
Great, thank you. And are people that are Medicaid recipients eligible for coverage through a special needs plan, or is that only for those on Medicare?
That is a good question, and I do not know the answer. But I will find out, and I will get it. Can I get it to you, or shall we put it up on our website?
Either or both. I will be
Okay.
able to respond to the person who asked the question.
Okay,
But
I
if you
will.
have it on your website, that's fine too.
I will get the answer and within a day and get back to you. That is a good question.
Great.
I do not know the
Thank
answer.
you. Thank you. Question about Medicare Advantage plans. Are those available to those who are dual eligible for Medicaid and Medicare, or is it only for Medicare recipients?
Again, I will answer that the same way. I do not know. I know you have to be Medicare eligible, but I will find that out.
Okay. One question came in about the cost of wills and trusts, and have you heard of the cost being a barrier for folks who may not have the financial resources to put those into place?
I think you can, I mean, most places, I live in the District of Columbia, and they take very simple wills that, you know, as long as you get it notarized and you have two witnesses. So I think if you have complicated assets, that's when it becomes more expensive and you really need a lawyer. You probably always need a lawyer, but people can't always afford that. So I think, you know, that's how, or you can find help. Probably, I think AERP has some of these clinics where they help people with financial, you know, assistance in their community. So that would be my suggestion, seeing what's available in your state, what's required of a will, where you live, and then seeing how you can find that information.
Great, thank you. Back to the question about the special needs plans for people who are dual eligible for Medicaid and Medicare. There actually were 3 people who wrote in, yes, there are D-SNPs that are called dual eligible SNPs. So that would be something for folks to follow up on to look for the availability of those if they're interested for themselves or for clients.
And thank you to the people who answered the question for me.
Yeah.
Sorry,
okay.
Sorry, I was just going to offer one more thing on the wills, and not every legal services. Yeah, not every legal services office does, you know, provide help. It depends on where they're located and what their services are, but often they can find help for people too. But, you know, that's usually in not in a big city area where it's probably harder to get that free assistance other than through somebody like the groups that I've already mentioned. So.
Great, thank you. Okay, let's see. Are you knowledgeable about any resources that may be available for people living with dementia or others who have no family to appoint as a financial power of attorney?
No. No, but I would think that the Alzheimer's Association must have that level of assistance.
Okay, great. I just wanted to make sure that folks are seeing, there are some questions that are coming through with resources, including one created by the National Alzheimer's and Dementia Resource Center. And I'm sending those responses out to everyone, so you should be seeing those responses coming through on the question answer pod. So I wanted to make sure that folks knew that it was coming to them, and that would be popping up on their screen. Can we, one person had a question back on slide 8. I'm going to go there now. Can you talk about, Laurel, if this is the cost of care for a lifetime or per year?
This is, as I noted at the beginning, it is the cost for 5 years, the last 5 years of life per decedent, and it covers the cost of Medicare, Medicaid, private insurance, and informal care. And they put that together. You can get more information on how they did that study on slide. It's there at the end. It's the slide number 37, the burden of healthcare costs for patients with dementia in the last 5 years of life. And you can see
costs to families is what you're saying.
Right. Yeah. Well, it is the cost of those things, as in Medicare, Medicaid, private insurance. It may be cost to the family. It may be, it's the cost to the individual. Maybe the burden is carried by the family. In the study, in the introduction to the study, they say what elements they covered.
Great, thank you.
Yeah, if I have no family, but my neighbor comes in and provides informal care, what does it cost my neighbor or me, and do I have Medigap insurance, and what does that cost? So it isn't necessarily the family at that point. There are a lot of things included in this overall cost.
Great, thank you. I just want to comment too, I'm seeing quite a few state-specific resources come through. And I wanted to ask the question because it seems like there's a lot of variation in the different state rules and resources, and it seems like a lot of the questions may be answered by looking at state-specific resources, and I'm curious if that's what you found when you've worked in this area.
That is certainly what I have found, that individual states provide individual benefits. And Medicaid, of course, is a combination of state and federal dollars.
Right,
and the states
right.
can choose how they provide.
Great, thank you. A few people had asked. Go ahead, Laurel.
Oh, I just noticed very quickly how adult daycare differs from a senior center, and that a senior center provides adult daycare.
Right, that's one resource that a senior center may provide, and there's also individual adult day centers that are separate from those. So but a senior center also may have lots of other activities as well for folks who don't need to stay the whole day.
Yes.
So let's see. There's lots of suggestions coming through of where people can look for resources. Is there any benefit to having a trust versus a will? Or both?
Yeah, I mean, I think that's so particular that I don't even want to answer that.
Very individualized depending on a person's situation.
Definitely.
Yes,
Okay.
What you want to do. But be sure you have one or the other.
Great, thank you. When you talked a little bit, Cindy, about, I think it was you, Cindy, that talked about when you set up the care agreement, if you're paying a family member, are there typical ways that that's done, and is this income reported for tax purposes?
Oh, definitely. I mean, there's a lot of different rules on that too, which are also state-based, and so it's complicated. And I'm really just sort of taking it from the treetop and not in the details of what you have to do. There are clear tax implications there. So.
Great, thank you.
I mean, we can look for something else, but we don't have anything I know on our website about that.
Okay. So one question came in. Go ahead.
No, that's all right. There was a question here about providing a list of the states that require filial responsibility. Again, if you Google filial responsibility, the 30 states will come up.
Great, thank you. There's a question that came in to ask if there's a reason why long-term care insurance was not listed as a financial option in the slide.
Because we didn't want to take up a lot more. It just didn't happen to get on the list. This is definitely not a cover-all list. It certainly is an option, and it certainly is something you want to look very carefully, but it is certainly something that can be there. No, there wasn't we are not covering it for a reason. It's just that we didn't get it on the list.
Great. Thank you for clarifying. So we have a few minutes left. Laurel and Cindy, do you have any other items that you want to mention briefly before I turn things back over to my colleague at ASA for final remarks?
Well, one thing I would just add about the long-term care insurance is that over the years, where there used to be, I don't know, something like 25 providers, many of the insurance companies have gotten out of that business. And so what's happening now is actually, and there probably may be some very innovative new products, but they're just not, they're not widely available, and I don't know enough about them that I would recommend them. But I think there's more to come because of the, the need, and people want the opportunity to buy some sort of long-term care, so they've been marrying the long-term care with the insurance, life insurance products, so that if you pay, for years, premiums, that at some point they can count toward the life insurance if you never use the long-term care. And so lots of things that are sort of bubbling there, but not yet. So, and a lot of times people don't like to hear that, long-term care insurance is something that people can buy because it's expensive. And so as an option for this population, if you have it, it's a good thing, but if you're going out to buy it for someone with dementia, it's probably pretty hard to get anything. So just adding that.
Thank you so much. Great, thank you. All right, well, I want to thank you both for a great presentation, and thank you for answering all these questions. We are just about to run out of time, so I want to send the presentation over to my colleague, Steve Morsom, for some final remarks.
Great. Thank you, Sari, and thank you, Cindy and Laurel, for being here with us.